experience sudden and overwhelming fear with panic attacks, brief yet distressing episodes of intense anxiety. Discover their symptoms, causes, and effective management in this overview.
What is panic attack? A panic attack is a sudden and intense episode of extreme anxiety or fear that typically reaches its peak within a few minutes. It can be quite distressing and overwhelming, often causing physical symptoms that mimic serious medical conditions. Panic attacks are typically a component of panic disorder but can also occur in other anxiety disorders. What symptoms of panic attack? Symptoms of a panic attack: physical symptoms: rapid heartbeat or palpitation, sweating, trembling or shaking, shortness of breath or feeling smothered, chest pain or discomfort, nausea or abdominal distress, dizziness or lightheadedness, chills or hot flashes. Emotional symptoms: intense fear or terror, feeling of impending doom or loss of control, feeling detached from oneself or reality, fear of dying. Treatment of panic attacks. Effective treatment for panic attacks typically involves a combination of therapies, lifestyle adjustments, and sometimes medications. It's important to note that the approach can vary based on individual needs and preferences. Here are some common methods. Cognitive behavioral therapy, CBT. This type of therapy helps individuals identify and change negative thought patterns and behaviors that contribute to panic attacks. Exposure therapy, a subset of CBT, gradually exposes the person to the situations or sensations that trigger panic attacks, helping to reduce fear over time. Medications. Certain medications can be prescribed to manage panic attacks. The two main types are antidepressants, Selective Serotonin Reuptake Inhibitors, SSRIs, and Serotonin-Norepinephrine Reuptake Inhibitors, SNRIs, are commonly used antidepressants that can help prevent panic attacks over time. Anti-anxiety medications. Benzodiazepines are fast-acting medications that can provide relief during acute panic attacks, but they are generally used with caution due to their potential for dependency and side effects. Relaxation techniques. Learning and practicing relaxation techniques like deep breathing, progressive muscle relaxation, and mindfulness meditation can help manage anxiety and reduce the intensity of panic attacks. Lifestyle modifications. Making certain lifestyle changes can also contribute to managing panic attacks. Regular exercise, adequate sleep, balanced diet, limiting caffeine and alcohol intake. Stress management techniques. Process of treatment. Assessment. A mental health professional will assess the severity and frequency of panic attacks, as well as any underlying causes or contributing factors. Therapy. If appropriate, cognitive behavioral therapy, CBT, or other therapeutic approaches will be recommended. Therapy sessions will focus on identifying triggers, changing thought patterns, and developing coping strategies. Medication. If needed depending on the severity of the panic attacks, a psychiatrist might prescribe medication, often in conjunction with therapy. Learning coping strategies. Individuals will learn techniques to manage panic symptoms when they arise. These can include deep breathing, mindfulness, and grounding exercises. Progress monitoring. The effectiveness of the treatment will be monitored over time. Adjustments to therapy or medication might be made if necessary. Long-term management. With effective treatment, many individuals experience a reduction in the frequency and intensity of panic attacks. Long-term management involves maintaining healthy habits and continuing to use learned coping skills. Remember that treatment outcomes can vary, and it's important to work closely with qualified mental health professionals to determine the best approach for your specific situation. If you or someone you know is experiencing panic attacks, seeking help from a mental health professional is recommended.